The PALOMA-3 study is a global randomized Phase III trial comparing the pharmacokinetics, efficacy outcomes, and safety of subcutaneous amivantamab compared to the intravenous formulation plus lazertinib in patients with EGFR-mutated advanced lung cancer who've progressed on osimertinib and platinum-based chemotherapy. Amivantamab is a MET and EGFR targeting bispecific antibody, which is currently approved as an intravenous formulation. However, the first dose of intravenous amivantamab takes over 4 hours and actually needs split dosing, and the infusion-related reaction rate is 67%. A subcutaneous formulation was developed to shorten the administration time for patients, and what we found in the original dose-finding PALOMA study was that the rate of IRRs experienced by patients was also markedly lower. So in PALOMA-3, we compare the pharmacokinetics, efficacy, and safety of the two formulations plus amivantamab. The overall arms were well balanced in terms of baseline demographics and disease characteristics. We randomized 418 patients overall, and what we found was that pharmacokinetics were non-inferior for the two arms with combination lazertinib. Also, when we looked at response, this was also non-inferior, approximately 30% in both arms, and duration of response was 11.2 months with subcutaneous amivantamab, slightly longer than with intravenous at 8.4 months. Median progression-free survival was numerically longer with subcutaneous amivantamab, and to our surprise, overall survival was significantly longer in patients receiving subcutaneous amivantamab and lazertinib. The hazard ratio was 0.62 and the p-value 0.02. Toxicity, by and large, was similar between the groups, with a few notable exceptions. Treatment was very well tolerated. The rate of discontinuation was 9% and 12% in the sub-Q and the IV arms, but IRRs were seen in only 13% of patients receiving subcutaneous therapy compared to 66% of those receiving IV therapy. We also looked at the rates of VTEs, and this is the first study to look at anticoagulation prophylaxis with amivantamab and lazertinib. In patients that received prophylaxis, and 80% of patients in the trial did, the rate was 10%, which was half of the rate in those patients who didn't receive prophylaxis, which was 21%. The other interesting finding from the study was that we were able to give subcutaneous amivantamab in less than 5 minutes using one simple syringe at the bedside, compared to over 5 hours for the first infusion of a 2-day split dose with IV amivantamab and 2 hours for subsequent IV infusions. 85% of patients reported greater convenience with the subcutaneous formulation compared to intravenous amivantamab, and overall, PALOMA-3 really demonstrates the pharmacokinetic non-inferiority, the efficacy non-inferiority, and in sometimes perhaps even superiority, as well as better tolerability and convenience with a reduction in IRRs, a reduction in VTEs, and a significant time in the reduction of time for treatment.